So, Paul, diagnosing OA in older adults, it's not much different from diagnosing OA in younger adults, right? I mean, not really. I'm not tricking you here.
Yeah, no, I do less diagnosing OA in younger adults, but yeah, no, that's right. Like it's probably if you take care of primary care patients, you've seen plenty of arthritis, so you know it's the things that you're looking for, or so the absence of features that make it sound like an inflammatory arthritis, which I know is a little bit of a confusing term. But so basically, what I'm saying here, Matt, is that they don't have morning stiffness if they're able to kind of get up and go. If the pain gets worse over the course of the day, as opposed to getting better with movement, if they don't have systemic features like fevers and malaise and that kind of stuff, that is more suggestive. So the absence of those symptoms is more suggestive of osteoarthritis. Tends to affect the big joints, but then also the hands and fingers. And it can also happen in joints that have been previously damaged, so you have this post-inflammatory arthritis as well. So, like, it's if you have those features, you can be pretty confident that you're dealing with OA, and maybe don't even necessarily need to get imaging, though I recognize that many patients will just for, I don't know what, proof of concept, I guess.
Yeah, you said post-inflammatory, but I usually think of it as like someone
Oh,
has
thank
like
you.
dislocates a
Post-traumatic.
shoulder and
Yeah.
then they have like arthritis in that shoulder. Usually people don't get osteoarthritis of the shoulder until they're in like their 80s. But if they've had dislocations, which I will ask about if someone has shoulder pain, then they might get it at a much younger age. So
Yes, thank you for
yeah, I
clarifying.
knew what you meant. But so yeah, this arthritis versus arthralgia. When I was first starting in my career as an internist, this was a big area of like for me where I was like always worried. I don't want to miss inflammatory arthritis. And there are some rheumatologists and people that I had heard give good talks on arthritis versus arthralgia. So I think most people, once you've been in primary care for a while, you get a pretty good sense. But sometimes you get these cases where like they don't just quite fit into one bucket. It's like, do they have morning stiffness that lasts more than an hour? It's kind of hard to tell from the history. And you're not sure. It sounds like they might have had some joint inflammation at one time, but even if you're not seeing it on exam there. So, sometimes you have to do a little more investigation.
It's why I self-corrected. If I remember the episode from 17,000 years ago with Dr. Neoji, like I think she made the point that even osteoarthritis is inflammatory. So like the idea of this
Yeah,
inflammatory versus non-inflammatory is a little bit artifactual, just because the inflammatory arthritides are really like robustly inflammatory, but there's still
right.
inflammation even with osteoarthritis. So it's
Yeah.
I'm not sure that's a meaningful distinction or not really.
And I brought this up with Dr. Makris, and I don't know how true I don't know. Like this is just anecdotal, but I have noticed, and she sort of agreed with me, but that like when people if people are doing all the wrong things, like the whole American lifestyle, like they're not moving, they're eating terribly, and then all of a sudden they just like start to fix their lifestyle. They're eating better. They're eating like fruits and vegetables. They're just eating whole foods in general. Then and they start to move. They start to do some exercise or some walking, whatever. People tell me my joints feel a lot better, and
Mhm.
who knows what if that's the processed foods that they were eating, and now that it's the diet did the changes, or that it's just that they're exercising that's releasing like helpful chemicals that are making them feel better. Whatever it is, I do think there's something to it. Like you're kind of their body is getting into a better just natural state from that. So I do think osteoarthritis. I remember her saying that, Paul, too, and I'm linking this to your point that I do think there is this like inflammatory state, aggravated state of the body that if you fix those things, they get better. But then you meet some people that have arthritis and they're doing all the right things and they still have it. So it's obviously that's not the only thing. That's not my point. And the reason she said imaging is not necessary, because we did talk about that. I think everyone always wants to jump to imaging and they want to jump to a ton of lab testing. So if it's obvious osteoarthritis, like they have a knee that's stiff after they've been sitting for a while and it kind of loosens up if once they've taken a couple steps, but if they walk too far, the knee hurts again, that sounds like arthritis. And you don't necessarily have to get an x-ray because the severity of what you see on the x-ray doesn't necessarily correlate with symptoms, and it doesn't necessarily change anything you're going to do unless you're planning like a surgery. So I'm not getting x-rays on everyone, but most people just seem to find a way to get an x-ray. And if someone really wants an x-ray, I'm just like, fine. You want to know what the knee looks like? It's okay. But I tell them, I'm expecting that we're going to see some joint space narrowing. And, just because we see it doesn't mean that you can't move. Because, like, you don't want someone to see that they have bone on bone arthritis and then just think that they can't do anything anymore.